Good morning. Thank you for tuning in to Epiphany Health. Coffee with the doctors.
Good morning.
Good morning. I'm Ann Horner, office manager, also known as Shaky McGee. Give you a little tour of the office. This is our lobby. We like to call it a lobby, not a waiting room, because I'm not waiting in here very often, for very long. It's amazing they let me do this because I usually can't talk and chew gum at the same time. Good morning, Sue.
Good morning.
Sorry we got a little bit of a late start. Here's one of the exam rooms. And here's Candace Nickel, our nurse practitioner. Good morning.
Hello.
Good morning.
Yevgenia. She's one of our team, and Brittany.
Happy Friday.
Happy Friday.
Good morning.
Good morning.
Good morning.
Second time's a charm.
Well, this is take 2 of week 2 live at Epiphany Health.
Sorry we're a little late.
We're still figuring out the go live on Facebook, but we're glad you're here. We're glad you joined us. And we're especially proud of how it went last week. We got so much positive feedback from you guys, and we've accepted such a warm embrace from this community. It's endearing. So after 4 years of doing the direct primary care, we just kind of wanted to show you a little bit more about our home and the staff and the family here. And Dr. Gross, what words do you have to say?
See, I am Shaky McGee. Hi, Martha.
Hello. Are we right side up or upside down?
No, you're good. I see you right side up.
Any feedback from our friends? Well, I'm getting dizzy now. Whoa!
No, Martha says good morning.
Good morning, Martha. Thanks for all your support. So, if you watched our video from last week, you may have seen when we were talking about the weather, we were sitting in this room.
Oh, we are sideways. Thank you, Arlette.
All right, wow, I feel that's much better. Thank
See,
you.
I told you. I don't know why you guys trust me with this.
All right, that's better. So last week, if you watched the video, you may have seen that we were talking about the weather in this room, and both of us looked up at the ceiling. You may want to pan up and show what the ceiling in this room looks like. In fact, we have a beautiful 2-story ceiling here. We can see the sun shining. It's a nice, brisk 58 degrees here, and
Our skylights.
Our skylights. This room we're in right now was actually my very first office when I started practicing in 2002. We were in this building. Moved next door for a little while. Dr. Crouch joined us almost 10 years ago now. And we moved back here in 2009 and took over the whole building. So growing empire.
Mm-hmm.
So it's Friday. Cheers.
Cheers to you again.
We made it another week.
Another successful week.
Cheers.
Cheers. One of the things I wanted to do was share a patient testimonial about our practice. You know, first of all, you got a little tour of the practice. I think as we walked in, it might have been a little abbreviated, but you know, people hear $60 a month and they think they're going to be sitting in the health department or a bus terminal. And we really have an absolutely beautiful facility here. Arguably one of the nicest doctor's offices you'll ever be at. In fact, some people I think just come and hang out in our waiting room and just because it's so peaceful out there. And it's actually not a waiting room.
We call it a lounge.
Lounge, in our lounge. So anyway, I just want to read a testimonial that actually just appeared in the John Locke Foundation published report on direct primary care, and John Locke Foundation out of North Carolina. And they featured our patient's testimonial, actually did a one-page write-up on our patient based upon this testimonial, but it says, "My husband and I dropped our health insurance after it more than tripled our plan costs, raised our deductibles to outrageous amounts, and reduced coverage in many important areas. We couldn't even afford to see a doctor after paying for our plan, let alone meeting the deductibles. So the search began. I read articles about Epiphany Health online and was excited at the possibilities of actually having true health care again without any hassles. Epiphany Health has saved us over $15,000 and counting so far this year. We received excellent care from the doctor and his team, massive discounts for lab work and imaging, over $2,000 savings today alone, which has spurred this review. Excellent advice for savings on prescriptions. He saved me $9,000 on a prescription last week. I'm sorry, $900 on a prescription last week. We're no longer worried and confused about whether or not our visits are paid for on this day or that, whether or not we're going to have to pay up front and wait for our insurance company to finally pay us back. The confusion has ended. I no longer feel like I need to hire an attorney and an accountant just to guide me through my policy. This is one of the best financial decisions we've ever made. If you're sick of the nonsense and want a better way to manage your health care without the headaches and also want an awesome doctor-patient relationship, you can't go wrong joining the Epiphany Health team. This idea needs to go nationwide because Americans are starving for simple healthcare solutions. I cannot thank them enough for all they do for us. That's awesome.
Kind words. Very, very much appreciated.
Thank you for putting that testimonial out there. Anyone that wants to put a testimonial on our Facebook page, we certainly welcome the reviews. We welcome the positive feedback. We welcome any critiques. Give us a call.
Critique my videoing, which is always good.
Very good. Well, thanks again for joining us this week. Anything else you want to disclose? I know everyone has a busy Friday.
Oh, it's going to be a great weekend, beautiful weather.
All right.
Enjoy, be safe.
Thanks, guys.